Your liver could be dying right now and you wouldn't even know it. Shocking. Absolutely. As a doctor who's seen the worst case scenarios, let me tell you, the most dangerous illnesses are the ones that sneak up on you quietly. One day, you're fine, and the next day, you are in the ER hearing words like liver failure and transplant. I do not want that for you, and in this report, I'm going to explain the 7 silent symptoms that your liver is dying, signs most people miss until it's too late. Here's a doctor's warning: you must act on these early or risk irreversible damage. I'm Dr. Ace. I've witnessed too many patients realize too late that their liver was in serious trouble, so listen closely. Some of these symptoms might seem trivial or unrelated, but these together they will paint a chilling picture. And stick with me, because to the end of this video I'm going to explain the last symptom, a symptom that is so unexpected that it catches even other doctors off guard. Are you ready? Let's dive in. And as we go through each silent warning, I want you to mentally check whether you've experienced any of them or not. If you have, don't panic, just pay very close attention. Your body could be whispering about a problem, and today we're going to learn how to listen and resolve it. Number 1. Unexplained fatigue and weakness. Every morning you wake up feeling like you barely slept. By mid-afternoon, you're so drained that even holding a conversation feels like running a marathon. Does this sound familiar? Well, unexplained fatigue, that bone-deep exhaustion, is often the very first whisper that your liver is in distress. And I know what you might be thinking. Doc, everyone gets tired eventually. Isn't this just age or stress? Sure, we all feel tired sometimes, but this is different. This is persistent weakness that doesn't improve with rest. In fact, studies estimate that between 50 and 85% of people with chronic liver disease suffer from crushing fatigue. It's not just in your head, it's in your body also. Literally, your body is losing its energy to function. When your liver is struggling, toxins build up and your metabolism slows down, leaving you feeling wiped all the time. Let me share you a quick story. A 55-year-old patient of mine, let's call her Linda, came to me in tears. She used to be active and lively, but lately she felt like she was walking through wet cement daily. Her family doctor brushed it off, telling her everyone feels tired. She even started doubting herself, wondering if she was just lazy or going crazy. But deep down, Linda knew something was wrong, and she was right. When I ran some tests, the truth was revealed. Her liver enzymes were off the charts. Her liver was silently failing, even though she looked fine on the outside. I'm telling you, as a doctor who's seen it too many times, do not ignore unexplained fatigue. If you are sleeping enough, eating well, and you still feel exhausted for weeks on end, consider it a red flag. It could be your liver waving a small SOS flag, hoping you notice. The good news, catching this early can literally save your life. So let's keep digging, because fatigue is just one piece of this puzzle. Sometimes the warnings aren't about how you feel, but how you look. Number 2, yellowing of eyes or skin, which is also called jaundice. Imagine this: you glance in the bathroom mirror one morning and the face looking back at you has a subtle golden hue. The whites of your eyes look yellowish, almost like old parchment paper. Your heart skips a beat. This isn't normal. In medical terms, it's called jaundice, and it's one of the more glaring signs that something is very wrong with your liver. I once had a patient, a tough retired firefighter, who laughed this off, saying he must be eating too many carrots. But I saw the truth immediately. His liver was barely hanging on. When the liver is failing, it can't properly filter out a yellow pigment called bilirubin. That pigment starts building up in your blood, staining your skin and your eyes yellow. Jaundice can make you see the world in a yellow tint, literally seeing life through yellow lens. This kind of yellowing could never happen to you, right? Think again. Sometimes it's so subtle at first that you only notice it in a certain light or if someone else points it out. A friend might say, "Hey, are you feeling okay? You look a little bit yellow." It's a shocking moment, and it's meant to be. Your body is sounding a loud alarm. This is not a symptom to put on your ignore and hope it goes away list. If you ever notice your eyes or skin are turning yellow, act immediately. It's a sign that your liver is overwhelmed, and you must seek medical help. Remember, while jaundice often appears in later stages of liver trouble, catching it early gives you one last chance to turn things around. Now, not every liver warning will be as obvious as a yellow face. Some are hidden in places you might not inspect often, like your toilet. This isn't dinner table conversation, but it's vital. Pay attention in your bathroom. Your urine and stool can carry early clues about liver health. Dark urine, we're talking about brownish, Coca-Cola colored or deep amber, and pale clay-colored stools are silent screams from your liver that something's wrong. One of my patients, Zach, a 60-year-old man, noticed his urine was turning the color of dark tea one week. He shrugged it off, figuring it was just a bit of dehydration. Around the same time, he saw his stools looking lighter and lighter than normal, almost beige, that he blamed on a new diet that he had started. He had excuses for everything, you see, never realizing these were open loops his body had left trying to hint at the truth. By the time he connected the dots, his skin had already turned yellow and he was in liver failure. Here's what's happening. A healthy liver dumps a substance like we talked about called bile, which is full of bilirubin and other pigments into your intestines, which give your stool the brown color. It also filters bilirubin into bile, so it exits in your stool. If your liver is sick or your bile ducts are blocked, that bilirubin has nowhere to go. Your poop can turn pale, like clay or putty, because less pigment is reaching it. Meanwhile, the bilirubin starts to build up in your blood and overflows into your urine, making it dark, brown, or orange. So if you see beer-colored urine in the toilet or oddly light stool in the toilet, don't ignore it. These signs often show up before full-blown jaundice, which is the yellow skin. It's your liver's way of whispering, "Hey, I'm backed up here." Next time you go to the bathroom, remember, your body leaves clues everywhere. It could be the difference between catching a liver issue early or missing it entirely. We've covered fatigue, we've covered jaundice, and now even the bathroom is sending signals. But next is a symptom so subtle you might just scratch it away without a second thought. Literally. You know the feeling, not quite of a mosquito bite, not quite of allergy, just a maddening itch. Often it's worse at night. You might be surprised to learn that persistent itching can be a silent cry for help from your liver. I recall a patient, let's call her Amelia, she was in her early 40s, who told me she would lie awake for hours scratching her arms and legs. She said, "Doctor, sometimes I scratch until I bleed and I still can't make it stop." She tried changing soaps, laundry, detergents, even took anti-allergy meds and nothing helped. It turned out her liver was the culprit all along. Hard to believe, right? Here is the science in simple terms. When your liver isn't filtering properly, bile can build up in your bloodstream. These bile salts circulating where they shouldn't be, they can deposit in the skin, causing intense itching. No rash, no hives, just itching from the inside out. It's a known symptom in cholestatic liver diseases, which are diseases where the bile flow is reduced. The Cleveland Clinic actually lists skin itching as a common symptom of cholestasis. Now, think about how easy it is to dismiss an itch. You might blame it on the winter dry air or just say it's sensitive skin. But if you have an itch that persists for weeks, especially if it's all over or in strange places like your palms and soles, pay attention. Does moisturizing not help at all? Is it worse at night, making you want to scratch your skin off? Don't just endure it, investigate it. It could be one of the only early signs of a liver issue, brewing beneath the surface. Let me ask you, if you had a stone in your shoe, you would take the shoe off to find it, right? Likewise, if you have an itch that won't go away, you owe it to yourself to find out why. Don't just keep scratching the surface, literally and figuratively, because sometimes the problem runs deeper. And speaking of things that run deeper, our next silent symptom is something you might notice after a minor bump or scrape. It's easy to brush off, but it reveals a fundamental breakdown in your body's internal chemistry. Number 5, easy bruising or bleeding. You bump into the coffee table lightly and by the next morning you have a huge bruise. Or you nick yourself shaving and it takes forever to stop the bleeding. These are not just signs of getting clumsy or aging, they could be signs your liver is in trouble. Let's break this down. Your liver is like a factory for crucial proteins, including the ones that help your blood clot. When the liver is damaged, it produces fewer clotting factors. The result? You bleed more and easier and bruise at the slightest touch. Think of a car with worn out brakes. Even a slow tap can lead to a crash. Similarly, with a compromised liver, even a minor bump can leave you black and blue. A patient story comes to mind. A gentleman, Noah, 65 years old, came to me confused about strange bruises on his arms and legs. He said, "Doc, I wake up and find new bruises, and I have no idea where they are coming from." He even wondered if he was sleepwalking or if his medications were making him prone to falls. But when we did a workup, we found his liver function was poor. It wasn't making enough clotting factors and his blood was practically begging to leak out of the vessels with the slightest provocation. Have you noticed more bruises lately? Gums bleeding when you floss? Maybe you wrote it off as just getting older or being on aspirin. But consider this. If it's out of the ordinary for you, then it's out of the ordinary, period. Your body doesn't just start bruising off for no reason. This is your clue to check under the hood, meaning check on that liver. And like all these signs, the sooner you respond, the better your chances to fix the underlying issue. Now let's move from bruises to something a little bit more visible and sometimes a bit more uncomfortable in daily life. This next symptom can be painful and obvious, yet people often hide it out of embarrassment. But you need to know about it because it can be a huge red flag. It's number 6, abdominal swelling or pain. Many folks joke about having a beer belly or looking a few months pregnant despite being a man after a big meal. But if you notice your abdomen bulging up, not because of pizza or beer, especially if it comes with discomfort or pain, pay close attention. Abdominal swelling could be due to fluid accumulation, a condition called ascites, which often signals advanced liver disease, and abdominal pain, particularly in the upper right side where your liver lives just under your rib cage, can be another alarm bell. Picture this: a man in his late 50s comes to my clinic wearing an oversized jacket. He was trying to hide his swollen belly. He told me, "I haven't changed my diet, doc, but I keep getting bigger," while patting his stomach. He also mentioned a constant pressure under his right ribs. He thought it was just weight gain and maybe a pulled muscle, but I knew right away what it could be. After some tests and a quick tap on his belly, a physical exam trick, it was clear his abdomen was filled with fluid. His liver had become so scarred, cirrhotic, that blood was backing up and fluid was leaking out into the abdominal cavity. We drained liters of fluid from him. Imagine this. His belly was swollen with over a gallon of liquid because his liver was failing to do its job. Scary, right? But here's something scarier. About half of people with cirrhosis, which is serious liver scarring, will develop ascites, which is belly fluid buildup, within 10 years of the diagnosis. It's common in later stages of liver disease, so that stubborn belly fat might not be fat at all. It could be a sign of liver dysfunction. And let's not forget pain. Liver pain is typically dull, heavy ache in the upper right abdomen. Some describe it as constant pressure or a stitch in the side that doesn't go away. If your liver gets inflamed or enlarged, it stretches the capsule around it, causing pain. So if you're feeling unexplained aches or noticing your waistband suddenly getting tighter due to a bloated tummy, don't just buy bigger pants. It's time to see a doctor and find out what's going on. Alright, we've covered 6 powerful warnings so far, but I've saved this last one because frankly it's the most important one. It's the one people never associate with the liver, and it's a bit taboo and a bit embarrassing, yet incredibly important. I saved it for later. If you've been zoning out until now, it's time to snap back because this last symptom might just surprise you. Number 7 is hemorrhoids and rectal bleeding. Yes, You heard that correctly. Those painful, itchy hemorrhoids you thought were from sitting too much or eating too much junk food could actually be connected to your liver. Hemorrhoids and unexplained rectal bleeding can be more than just a nuisance. They might be a red flag for advanced liver disease. Here's how it works. When your liver is scarred from cirrhosis or other damage, it's like putting a kink in a garden hose. The blood that normally flows easily through the liver meets resistance. The pressure builds up in the veins, which is a condition known as portal hypertension. Now that backed up blood has to find another route. Unfortunately, some of those back roads are veins in your rectum and anal area. One liver specialist once described it to me in a vivid way. Liver disease is a cause of hemorrhoids, as a backup of blood flow from the liver will lead to a backup of drainage, dilating the veins, causing hemorrhoids. The notes here mean that if the liver becomes scarred, imagine that the pipes that drain your blood through it are being squeezed. The blood has to go somewhere, so it balloons out to the veins elsewhere, like those in the bottom. I know hemorrhoids are uncomfortable to talk about. Many people just buy some cream at the pharmacy and suffer in silence. But if you have chronic hemorrhoids or see rectal bleeding, especially if you know that you have any of these risk factors for liver disease, like a history of hepatitis, alcohol use, or fatty liver disease, do not just assume it's just hemorrhoids. It could be a sign of portal hypertension from a failing liver. I've seen patients come in thinking they just had stubborn hemorrhoids, and they left with a diagnosis of cirrhosis that saved their lives. Because now we know what was going on, and now we could treat it. I remember one such patient, who we'll call John, was in his early 60s and had been battling what he thought were ordinary hemorrhoids for months. He was embarrassed, so he never mentioned it during his regular checkups. When he finally did, I immediately ordered a liver workup. The results floored him. His liver was severely damaged, likely from years of drinking alcohol. Those annoying hemorrhoids were actually the tip of a very dangerous iceberg. He told me later, with tears in his eyes, I almost didn't say anything. I'm so glad I did. I've seen patients make outstanding recoveries when they caught the problems in time and their lifestyles changed enough. Your mission now is to act, and if you're experiencing any of these symptoms, don't just wait. Schedule that doctor's appointment. Get your blood tests, ultrasounds, whatever it takes. Be proactive, not reactive, and the worst thing you can do is stick your head in the sand and hope it goes away. Also, share this video, this knowledge with your friends and family, anyone who might be dismissing these signs. You might save someone else's life, not just your own. Health information is powerful, especially when it's potentially life-saving. If you consider this video helpful, consider liking and subscribing to this channel. I thank you very much for watching, and I see you in the next video. Bye bye!